Yes.
Good
No
afternoon.
smiles?
Good afternoon,
Good
Father.
afternoon, good afternoon, good afternoon. Yes.
Yeah, good afternoon.
Good afternoon.
Mini.
Good afternoon.
Yeah.
Bhavani, how are you? Doing good, Elise?
Fine, Father.
Okay. Good afternoon, good morning, good evening. Wherever you are from, please type in where are you from. Yes, good evening. At YouTube comment space, please type in where are you from. And if you have reserved your slot for registration, just type registered. Just type Zoom registered. Type in Zoom registered if you have registered. Yes. Be ready, everyone. Yes. Zoom link, please. Yeah, the Zoom link will be posted soon within 2 minutes. But only those who have reserved your slots will be admitted. Okay. Others have to learn to reserve. Yes. Type in where are you from? Some emojis, smileys. Yes. Yeah. Zoom link is posted. If you have reserved your slot, please join. Yeah, we'll be starting soon in 2 minutes. Get in fast. Yes. Zoom link is posted from Edu Skills. Yes.
Good evening, Father.
Very good evening, everyone.
Good evening, Father.
Very good evening.
Good evening, Father.
Very good evening. Yes. See if admin is not smiling. That's why others are not smiling. Type in where are you from at YouTube comment space. Even those who are here, please go and message there so that we connect with them. And if click the like button, send a message, some emojis. Yes. Yeah. Bharati. Libby, you have to unmute your video soon, otherwise you'll go out fast. At YouTube, if you have reserved your Zoom slot, you can use the link and join. However, you have to unmute your video, okay? Yes. Cool. Come fast. We have to start fast, yes. Yeah, try to remind and share the contacts to your links. Please type in where are you from.
Satya, please switch on your video.
Good evening, Father.
Good evening. Very good evening.
Satya from Singapore, Father.
Yes, Sophia. Good evening and welcome.
Thank you, Father.
Yes. Mm. Yeah, please interact in the comment space so that we reach out to people immediately, please. Mm. Sham. Yeah, you have to join the YouTube live first. From there, you'll be admitted to the Zoom classroom. Yes. People don't read notice, right? Repeatedly, we say, click on this link and reserve your slots. They will say, add my name. Add my name will be the response. What to do? We are starting in 2 minutes. We are waiting for others to join. Yes, we'll be going with the reading, OET reading today. A new strategy. We'll be discussing today about the opinion-based questions. Those of you here at the Zoom, please type in. You are in the Zoom classroom at the YouTube comment space. Just type in you. I am at Zoom classroom. Yeah. Those who are in the Zoom classroom, please connect with your spare instrument and try to interact with the people at the YouTube comment space. I want you to see all of you message there. It's fast. Let's not waste time. Make it a point always when you are at the Zoom classroom. You have to connect with YouTube Live. I'm just posting the links until all join.
Father, I have one instrument only, so that one can join Zoom.
Pardon? I didn't get you, sorry.
I have one instrument.
Okay.
Father, I have one instrument
Yeah, you can
and through Zoom only I am attending.
log in from the same instrument. Just click that link. You will be able to connect those.
Okay.
If there are two instruments, easy for you. But then even otherwise, you can just go to the Telegram as connected to the Zoom. You can even connect to the YouTube. There is no issue.
I think there is some network issues.
Okay. I think people have not kept up your promise to bring at least one, right? So let's end with today's session, I believe, because we have less numbers than yesterday. In spite of your promises. Type in where are you from? Yes. At YouTube comment space. Yes, Elise joined. Yeah, got your messages.
Good evening, Father.
Very good evening.
1 second, Father. There, Siba and the node, please switch on your video. If you are repeating same, you will be in a waiting room. Father is saying, I think, more than 3-4 times. You are not obeying. Even Anusha, please switch on your video.
Those who don't switch on, just take down the names and don't admit them again. Put them follow the basic discipline of the platform.
Siba, yeah, thank you.
We will not be repeating the same every day, okay? If you have not unmuted a video, you are not supposed to be in the Zoom classroom. Once you are banned, you will not be able to enter even the waiting room. So beware of it. There is a basic discipline of the platform. It's only for your own protection because there are so many spammers getting in. Yes. Please share to your contacts. I am doing it, but you are sitting there. I am sharing it. You don't want to do it, which means you will not have sessions. That's all. So I'm tired of saying this, and you promised you will bring at least one person today. I don't see any extra person here. Which means you are not serious about the training. Okay. Cool. Being selfish.
Are you lagging behind on current affairs? Everyone's already talking about.
Yeah, let's have a minute silent prayer. So good evening and welcome to EduSkills OET Medicine. Our mission is to make you fall in love with OET. If you are watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work. and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. Today, we'll be looking into reading again, a new strategy, opinion-based questions, how to easily answer opinion-based questions. At the same time, if you have more stamina, we will go into some more practice on elimination methods. Let me share my screen. At YouTube comment space, please type in if you am audible and visible. Let me know if the screen is visible to you. Just type in yes at I want at YouTube comment space their response. Yes, admin, please let me enter in. Zoom class Prashant Yadav, did you book your slots? You are supposed to reserve your slots at YouTube comment space. In which case you'll be admitted, okay? Otherwise, after some time, we will make slots for you. We have been repeatedly telling you, we post the link in advance. Those who want to be at Zoom are supposed to send a request at YouTube comment space. However, we will admit you after some time after first segment. Okay. Yes, Father. Okay. Thank you. Yes. Visible. Okay. Yeah, opinion-based questions, you know, the reading part C, and this also required for listening part C as well. So opinion-based questions are the most important aspects in reading part C. Most of the questions will be based on opinion, suggestion, attitude, and you have questions on, sometimes you have some questions on gist, based on gist, and sometimes you have, even most of the times you have vocabulary questions, reference questions, and lexical questions from each text. Today we will be focusing on opinion-based questions. We will have one practice first, then we will get into the strategies, how to identify the opinion. Okay, opinion means someone's opinion. Now, those of you who are here in the classroom, you can, if there are no distractions, you can shout. Sir David Nicholson's comments show that he believes statins. What's important here? Hedging words, keywords in the question stem. This first line is known as the question stem. Yes.
David Nicholson.
David Nicholas.
David Nicholson. Yeah.
Believes.
Means this is the name. Yes, that is the most important thing. And believes says. And people keep on asking me, how do you identify question types? Now, how do you identify opinion questions? Believes is the word tells this is a opinion question. And now, what are the heading words in option A? Should only be prescribed after other options have been tried. Anything?
Other options.
Prescribed only
Other options. Okay. Is there an absolute here?
Yes,
Only.
Is it absolute? Is it an absolute here?
Only.
No, only an absolute.
What is the meaning of the option?
Yes,
You don't be
only
prescribed
prescribed
after other options have been
tried.
tried. Yeah. Yeah. Statin should be prescribed only after trying other options. Means not always, not only. Some incidents you can, when other options are exhausted, when you have done with other options, you can prescribe statin. Means in some cases you can prescribe statin. Correct?
Yes.
So don't be confused. That's why specifically I have taken this. 2, 3 of them I have taken because people are asking, there is one absolute here, but then that cannot be eliminated. Okay. Second option, option B, aren't as effective as diet in improving a person's health. What is the keyword, hedging word?
Right.
Diet.
Yeah, diet. Okay. Only work after you have been taking them for a while.
Work.
Only absolute.
Is it absolute?
No, Father.
No. No, because it works only sometime, right? Not always. Only means sometimes it is here. Only work after you have been taking them for a while. Yeah, for earlier it did not work, but after some time it works. So sometime it works, sometime it won't work. Sometime some is not absolute, right?
Yes, Father.
Yeah. Yeah, taking them for a while. Okay. Then don't work as an effective treatment for diabetes. Not effective.
No.
Okay. Treatment is a concept. Differentiating is not effective. Okay. Now, when there is a name, what are you supposed to do?
We go to locate the
Directly go to the name. Nothing you need to do. Just go to the name. Okay. Rest all can be ignored. Half of the paragraph can be ignored immediately. Okay. You go to the name. So you save your time. Okay. Now after name, what is this between commas?
subject complements.
Ignore them. You see how short the paragraph becomes within seconds. Okay. Whatever is waste, not required, you are throwing it out. Enter the debate over statins when he said he had stopped taking them as part of his medication for diabetes, and you have a inverted comma which gives his opinion. Normally in the opinions, if there are inverted commas, directly that is the words of that person, right? That's how you have learned, right? In your small classrooms, high schools and all. When there are inverted commas, when you quote someone, you put inside inverted commas. If a lifestyle change works, then why would you take the statin? Is there any option synonymous or having the same meaning? If a lifestyle change works, then why should you take the statin? Means first you have to try the lifestyle change. Then only after trying lifestyle change, if it doesn't work, then you can try statin. Right? So first option is change your lifestyle. Don't take statin. First option is change your lifestyle. Okay. So after that, you will be prescribed statin. Doctor says, first you do this for 3 weeks, change your lifestyle. Then if it doesn't work, I will prescribe statin. Which option?
A. Option A.
Option A.
Yes, option A. Option A. You have a doubt here because that's your competency problem, no problem. Gradually you'll develop. Option A clearly means life. See, if a lifestyle change works, then why should you take the statin? I'll read another way. If a doctor is asking you, if a lifestyle change works for you, then why should I prescribe statin? So statin will be prescribed only after other options. What are the other options? Lifestyle change. Diet. Another strategy I told you, though I have ignored here, let me take it back. Sorry. This portion I'll just show you something else. Okay. Believe. Now just have a look at the highlighted thing. The topic sentence. Okay. Heart disease is better treated by diet. What does it mean? What does it mean? Do you require statin?
Lifestyle.
Lifestyle.
No,
Diet means lifestyle.
Lifestyle.
Okay. Please mute. Again, there is somebody with your distractions. Please. That means you can just remove them. Okay. Because basic things we have announced. If you have background distractions, and don't do other business here. It means if you find anybody interacting and doing cooking work, you can just remove them. Okay. Don't admit them again. Be serious. Okay, it's basic that you have to respect the platform. Cool. Smile and now you see, I told you the topic sentence is very important. But once you are competent, you can directly go to David Nicholson and see what he says, and one of the options will be that. So when there is a name, but then if you want to understand better in the initial stages, try the topic sentence. Topic sentence says some people believe heart disease is better treated by diet. Other means such as diet. So topic sentence says not statin, but lifestyle change. Other option. Do you understand?
Yes.
You didn't get it? I will just duplicate it and I'll show you. See now, I'll just try to take those things and remove. Backspace. Backspace. See now, this is the first option. Sir David Nicholson's comments show that he believes statin should only be prescribed after other options have been tried. Now, the topic sentence says, I am removing those things which are not required. Some people believe heart disease is better treated by other means such as diet. You can make it simpler. Yeah. So topic sentence says, this is the topic sentence. Topic sentence. David Nicholson says, if a lifestyle change works, then why would you take the statin? Means lifestyle change should be opted first. Then only statin. The option A says should only be prescribed. Statin should only be prescribed after other options have been tried. What are the other options?
Diet.
Lifestyle changes. Yeah, diet or lifestyle changes. So even this topic sentence means the same. Repeatedly. Same meaning is given. Did you get it?
Yes. Yes,
Option A, now, let me put it here. Option A is equal to topic sentence is equal to David's statement or opinion. Okay, this third one is David's statement. This one here, David's statement. This is topic sentence. This is option. All these three mean the same. Even otherwise, if you take the other things, for example, the debate over statins when he said he had stopped taking them as part of his medication for diabetes. He has stopped taking statins. The trouble is that they give you statins straight away, so you don't know what is working. The trouble is immediately they prescribe statins. Okay. I am searching for the disturbing instrument. Okay, admins are not doing it. So I am going back and searching. Who is that?
Anusha.
Just remove her. We can't help it.
Sir.
If there is no sorry, ma. You have been repeating so many times. Don't do any other work when you are attending. You will never be attended to a Zoom classroom, okay? You are disturbing the whole process. Now I have to stop sharing. I have repeated so many times. Okay? How can you just say sorry and get away? Disturbing even people on the live, YouTube live. Admins, take note of that name, okay? If you have one more disturbance, please don't admit them again.
Yes, Father.
I'm telling you so many times, why don't you do that? People don't learn because they are doing some other work. The OET is not meant for such people, okay? That's what I said. It's okay. It's not sorry, ma. You don't have an attitude to attend the sessions when we are struggling so much for you. It's cool, fine. Yes, we understand your situations, but you are not supposed to be in the Zoom classroom. That's why we are taking the trouble to give you in live, YouTube live, when you have some different situations. Yeah. Come on now. Where are we? Okay. We are getting into the third strategy. Okay. This is done now. Okay. What is done? When the name is done. Second one.
Immediately jump into the name.
Yeah. Then you go to the statement, and that is the answer. Then topic sentence. To understand better, you have topic sentence. Again, I will clear this whole thing and tell you something else. Now, these are things not required always when you are competent, but then only if you have a difficulty, if you have a confusion, when you revisit, you can find out these things. Now, you see, you are asked about Sir David Nicholson's opinion, right? David Nicholson's comments show that he believes statins. What is his opinion about statins for diabetes treatment? Now, it begins with whom? With whose opinion? The first statement is
Some
whose
people.
opinion?
Some people.
Some people.
Some
Some
people.
people. So you need not worry. Okay. Then second statement says the opinion of a study. Some study.
Study.
You are not bothered about the study. Okay. Now, then third one says Sir David Nicholson.
David Nicholson.
Yeah, this can be used everywhere. Okay, so immediately you go to the name. When you have a name, immediately jump into the name. That's how you save the time. Without doing that, it's impossible. You can't save the time. You can't complete in time. Time management, you need not learn time management at all. If you learn the strategies, time is managed. Time management is the natural result of your competency. See, once you are competent, you see the name, immediately you go to that name, just ignore other things and read what that person says, what he believes. Just choose the answer. Now, the problem is you will have to improve your competency as regards the general language. Sometimes if you don't understand the general language, that by practice you will improve. Okay. So this one, if a lifestyle is, he has stopped taking the statin. And also his question, if a lifestyle change works, then why would you take the statin? I don't want to take statin. Should only be prescribed after other options have been tried. Sir David Nicholson believes statins should only be prescribed after other options have been tried. That way you have to read. Sir David Nicholson believes statins should only be prescribed after other options have been tried. Okay, so you can read this way. Sorry. Read this one. Yes. This is how you read them together. Sir David Nicholson believes statins should only be prescribed after the options have been tried. Sir David Nicholson entered the debate over statins when he said he had stopped taking them as part of his medication for diabetes. If a lifestyle change works, then why would you take the statin? Did you get it? So,
Yes,
yeah,
Yes, Father.
four strategies I have taught in one text here. When you share your learning experience in the main platform, you have to typically mention in short, what did you learn? If you have learned something new today. If you have learned it earlier, you need not mention what is your new learning. Okay. So this is the answer. I am highlighting only the answer thing because in the YouTube comment space, sometimes people ask, I'm confused. I don't know which is the answer. This is the answer. Okay, let's go on now to the strategies. This is another approach we are taking this time. First time, opinion-based questions. To select the correct answer, sorry, there's a mistake. It should be 5 skills, okay? It's a number mistake, that's right. 1. 3. May 1 sec this. Yeah, I'm giving you 5 skills to select the correct answer. Let me go back. Are you following me at the YouTube comment space? Just send some emojis, some hearts if you are following me at the YouTube comment space, please. Yes, good afternoon. Let me see, where are you at the YouTube comment space? If you have not clicked the like button, click the like button as well. Yes, yes, visible, yes. Okay, just type in, yeah. Yes, Father, yes, Lord's in studio, yes, Anipapads. Yes. Yeah, opinion-based questions. To select the correct answer, 5 skills. First one, identify opinions by marker words. Second one, identify opinions by hedging words. Give me one sec. Okay, opinion-based questions. To select the correct answers, 5 skills. First one, identify opinions by marker words. I'll be telling you what are the marker words. Identify, second one, identify opinions by hedging words. Third one, look for modal verbs. Fourth one, read for emotions or subjective agreement. Fifth one, look for opinions in the main clause. These are the absolute categorical strategies to identify the opinions. And most of the questions at listening part listening part C is opinion-based questions. Let's go one by one. Identify opinions by marker words. What are the marker words? It might say, in my opinion, I think, say, believe. These are the marker words. In this question, which word we had?
Believe.
Believe. Yeah, one of these could be there. Now, second option is identify opinions by hedging words. Already we have seen some of the hedging words. Probably, perhaps, maybe, likely. These are the hedging words denoting they are speaking about the opinion of the author or writer or someone. Okay? And read for emotions or subjective agreement. There will be words like compelling, interesting fact, or interesting element, remarkable, worthy of attention, unfortunately, sadly. These are the emotional words. Okay. Fourth one, look for opinions in the main clause. As I said, whenever there is a complex sentence, the message will be in the main clause, or also main clause is also known as independent clause. Complex sentence will have 2 clauses. One is dependent clause, other one independent clause. How do you identify the dependent clause? If the dependent clause comes first, if the dependent clause, yeah, there will be a comma. So here there is a comma, right? After service providers. So this is the dependent clause. So where will be the answer?
In independent.
In the independent clause. So whatever comes before comma, you need not read once you are competent. See, in this, you have nearly 4.5 lines and almost 3.5 lines. 80% is dependent clause. So you can just save your time. Despite the countless challenges that the OET aspirants face in the low resource environment created by various service providers, OET remains the best hope for many health professionals in building up their future. So what is the important message here?
OET remains the best hope.
OET is the best hope to build up the future. That is the main feature. Though it speaks about low resource environment created by various service providers or institutes, that's not important. Normally, the question generally, there could be exceptions. Okay, for everything there is an exception. Generally, the answer will be in the main clause. So again, you will save time. Okay. Look for modal verbs: can, could, should, must. See, now can, could is ability. Can is the present tense, could is past tense. Also, one sometimes for prediction or what you call speculation, it is used. So the function of this can or could is ability, possibility, permission. May, might, possibility. Should denotes advice, recommendation, or suggestion. Must denotes necessity or obligation or mandatory. When there is must, it is mandatory. When there is should, it is suggestion or advice. If should is used, for example, if a statement says you should follow the traffic rules, you cannot be given a bill, you cannot be penalized. It is not you should, you must follow the traffic rules. In the school, you must follow you must wear the uniform. If you say you should wear the uniform, it means it's an advice. Maybe the doctor will tell you, you should drink at least 3 liters of water every day. It is an advice. Even if you don't drink 3 liters, nobody is going to penalize you, punish you. Okay? So that is modal verbs. Let's see now. One example. Yes. Now, what does Dr. Saul object to? Hedging words?
Dr. Saul.
Yeah, name is very important. Whenever there is a name, that is the first thing. Anything else?
Object.
Yeah, object. Object is the opinion, right? Is opinion. Object speaks about his opinion. So that's also important. Option A, the suggestion that people need stimulants to cope with everyday life. He objects to the suggestion that people need stimulants. Okay, suggestion is secondary, but then stimulants is important, right? Stimulants. Okay. Suggestion is here. Now the question is, what does Dr. Saul object to? Dr. Saul objects to the suggestion that people need stimulants. So we have to read with the stem, the hedging word in the question stem. Now, Dr. Saul object to the implication that everyone has some symptoms of ADHD. Symptoms of ADHD. Okay. Then the grouping of imprecise symptoms into a mental disorder. Mental disorder is there. Differentiating, the grouping is there if you want. Okay. Grouping of symptoms, right? It's okay, whichever you want to take. The treatment for ADHD suggested by Dr. Berkeley draws attention to the poor care given to the children.
Dr. Berkeley.
That's the object to Dr. Berkeley's opinion. Now, coming to the text. Let me just take this side. Okay. Coming to the text. Now, what you have to do? Immediately?
To the
Dr. Saul, right?
Dr. Saul.
Immediately go to Dr. Saul. Okay. The first thing says, then you can just ignore these things once you are competent. Before that, you have to analyze all those things. We'll show you. Okay. Now, a behavioral, now there is comma immediately.
Subject complement.
Comma, between commas. What is it? Subject complements. What you have to do? Just ignore. Again, you see how easy it becomes opinion questions. So immediately you come to Dr. Saul, disagrees. Any synonym in the question stem? Disagrees?
Object.
Yeah, object. Disagree means object, right? I disagree with you. I object to your opinion. Yeah, many of us have difficulty with organizational details, a tendency to do things or to be forgetful or distracted. Under such subjective criteria, the entire population could potentially qualify. Now, although some patients might need stimulants to function well in daily life, the lumping together of many vague and subjective symptoms could be causing a national phenomenon of misdiagnosis and over-prescription of serum. Now, this is a complex sentence, right?
Yes.
As soon as you see a complex sentence after the name, you have the answer in which part, dependent or independent.
Independent.
Okay. Now, immediately you have to focus on independent. Yeah, I am taking a portion of it. You can take the whole thing. The lumping together of many vague and subjective symptoms. Lumping together. Do you have a
Grouping.
synonym anywhere?
Grouping.
Grouping.
Yeah, lumping together means
Grouping
grouping. Grouping.
of
Yes, lumping together, the grouping, the imprecise symptoms, imprecise, imprecise.
Vague.
What is the synonym?
Vague.
Vague. That's what that's what I said. You should have a diary of synonyms. Write down all these words in your diary as you go through the materials. And subjective symptoms, imprecise symptoms into a mental disorder could be causing national phenomenon of misdiagnosis and over-prescription of stimulants. Okay? The lumping together of many imprecise or vague and subjective symptoms into a mental disorder. He objects to it. You cannot lump together and say you are mentally sick. Subjective symptoms. Do you understand?
Yes, Father.
Yeah. So here you see he is objecting, disagrees. Many of us have difficulty with organization or details, a tendency to lose things or to be forgetful or distracted. These are the subjective symptoms. Many of us have difficulty organizing details, tendency to lose things, we forget things, we lose things, and we get distracted even during the live sessions. Does it mean we are mentally sick? Those are the subjective symptoms. Under such subjective criteria, the entire population could potentially qualify. Qualify what? Qualify as mentally ill people. Although some patients might need stimulants to function well in daily life, the lumping together of many vague and subjective symptoms is not okay. I disagree. Dr. Saul disagrees. So what is the answer?
C.
A. Lumping of
Yes.
many-
C, Father.
All. Yeah, which one?
C, Father.
Yeah.
C.
Yeah. Now again, you see, we are just taking it back again, this one. Okay. Now let's see the topic sentence. What is the topic sentence? ADHD can be a controversial condition. Does it give some hint to the text or the paragraph? But the controversial ADHD can be a controversial means they are saying in this paragraph we are going to speak about some controversy between some people. They are fighting each other, disagreeing each other, conflicting each other. So the gist is there in the topic sentence. ADHD can be a controversial condition. What is the controversy? Controversy between Dr. Barclay and Dr. Saul. And what are they asking? Only about the objection of Dr. Saul. We are not at all bothered about Dr. Barclay. Even if you read that, Dr. Barclay, which is not required for us, otherwise you will be reading all this. See, here again you have the professor of psychiatry at the University of Massachusetts. All these things are, this can be ignored, but we don't require that. But even if you are reading for your purpose, ignore those things. It is a real disorder which can be in many times again that is not required. To understand what is between commas is not at all required. Yes, how beautiful. Okay. So you have what you have to do. As soon as you see, once you are competent, I don't use that method now, but once you are competent, you are not going to do anything. If there is a name in the question stem, immediately you will search for the name in the text and read what is the objection by that name. Before that, whatever happens is not your cup of tea. Does it make sense?
Yes, Father.
Yes,
Yeah.
Yes, Father.
So beautiful. You should be smiling at it. Okay. So the answer is the grouping of imprecise symptoms into a mental disorder. Yes. Do you have stamina to go on?
Yes, Father.
Maybe we'll take 2 minutes break here. Yeah. Then we'll go with the next segment. Until then, if you want to ask something, you can ask me. Or if you want to snatch some snacks, some juice, some tea, coffee, take it so that you can enjoy. That means Manju Shibu is exhausted, so you need something, some snacks.
Oh,
You
for
can
the
grab now, okay? By the time others will discuss something, you can go and have. You can, yes. Yeah, somebody wanted to ask me something. Any clarifications? We are going into next segment immediately. Elimination will practice a little more elimination. Yes.
Yeah. In this paragraph, end of the paragraph, there is a word, no, universal phenomena. That means universally accepted, or what is the meaning really exactly for that?
No, like if you prescribe, if you say all these
Everyone.
subjective symptoms, for example, forgetting, getting distracted, and losing things, these are the subjective symptoms. They say it's a universal phenomena. These subjective symptoms are universal with everybody. You will forget something, you will get distracted, you will be disturbed, you will be emotionally disturbed, all those things.
Okay.
Those things are there, subjective. Symptoms are universal phenomena. Means everybody experiences some point of time. But then you cannot say he is mentally sick or she is mentally sick. That's what Dr. Rosal says. Now you see, for example, sometimes you try to go out, then come back and check whether you have put off the gas, right?
Like obsession.
Yeah. Can you tag that person as he is having OCD, obsessive compulsive disorder?
No.
No. That's what Dr. Soul says. Everybody will have, sometimes you will forget certain things. You'll be confused. You'll be having doubts. You'll be distracted. These are the subjective symptoms. If you consider those are the symptoms, it's a universal phenomenon. Everybody will be having OCD. The whole population in India will be having OCD, and India will have to, the whole country will have to declare as a mental hospital. That's the opinion. That's the irony by Dr. Saul.
Okay.
Got it?
Thank you.
Yes. Any other clarifications? At YouTube comment space. Let me just remove the spotlight and come back. Okay. Anything you want to type in at YouTube comment space? If you have any doubts, you can type in 2 minutes. After that, we are going to the next segment. A beautiful segment. The answer will be in an independent clause, a complete sentence with meaning. Yes, correct. This independent clause, dependent clause, complex sentence, this is going to be very, very useful in your writing segment, okay? You should know how to place them, how to put the comma. If you don't put the comma, what's the problem? Then you lose marks. So whatever we teach is a foundation program, which is useful for all the 4 subtests. Okay, even in speaking, you can use beautiful language. Yes, in terms, good afternoon, Father, from UAE. Good afternoon, Matthias. Yes. Right, type in something, send some emojis in the YouTube comment space if you are enjoying. Yes. So not like click the like button, please click the like button. Okay. Yeah. You can ask, give me 1, 2 seconds. You can ask me. Okay, shall we go on? No smiles. Nita, Sinoj seem to be tired.
Father.
Yes, Father.
Okay. Dolly Varghese is seen without, yeah. Competition because of break. Yes. You have to smile when you switch on the video. Yeah. Let me take you to the next segment. At YouTube comment space, are you ready? At YouTube comment space, are you ready? Yes. Ready at YouTube? Come on, type in if you are ready. Yes, Father, yes. Good. Again, I'm sharing my screen. Let me know if you can see my screen and if my visible, yes.
Yes, Father.
Yeah, cool. So we'll look into some more practice into elimination. This is going to be very interesting and easy. Okay. Eliminate the extremes you have already seen. Just I'm showing you just to recall. The top and bottom, they are the extremes, all few. 100% and 0%, all those are the absolutes which you can eliminate. Or else like always and never. These are the absolutes that you can eliminate. We have seen into that, so I am not explaining. So let's check some more elimination of absolutes. Okay. Avoid north and south options means extreme values. Words like never, all, every, always, none. These are the words. Yeah, there are more words, but some of the examples. So let's see some part B questions and how to eliminate. Most of the questions I am not very sure, but must be from the official OET website. Thank you, OET, for allowing me to use this for teaching purpose. Okay, now coming to this question. Oh, sorry. I lose the sharing. Can you see the screen?
Yes, Father.
Yes.
Okay. Now, what does the policy for manual handling equipment tell employers? What are the hedging words?
Manual.
Employees.
Okay, manual.
Handling equipment.
Yeah,
Tell them.
manual handling equipment. Tell the employers. Okay, all areas of the hospital should be fitted with overhead tracking.
Absolute.
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 All absolute.
Absolute. Okay, all absolute. So what should you do?
We should eliminate.
Eliminate.
Yeah.
Eliminate.
I did not say that. You said it. Okay.
According
I am not
to
responsible. Let's see. I am not responsible. The option B, assistance devices should be used over physically handling the patient.
assistant device is manual hand.
Devices.
Okay, devices, assistant devices or devices, whatever you want to. Yes. Okay. See, patients have the final decision on how they should be assisted. Final decision. Okay. Now, policy for manual handling equipment. Now, you know, once, since I don't know whether it is true or factual, anyhow, you have eliminated A, so you have only two options. You have to find which is the right one. Okay. Can somebody read this paragraph?
The policy for manual handling equipment.
the provision of ceiling hoist technology and air-assisted patient lifting equipment should be considered as the first-line handling aid by employers, as significant evidence exists that their use reduces operator and patient injuries. Overhead tracking should be installed in all new and refurnished facilities. This should cover beds as a minimum, but should extend to in suites and other areas of the facility where patients are likely to require assistance. Once an assessment has been made that equipment should be used for safe patient handling, then equipment should be made available and used even in situations where the patient's and or family's preference is for it not be used.
So, any clue?
B is the answer for that.
B is the answer, Father.
Father.
Why?
Because
Why not C?
Because it speaks about the device.
Not in the.
We want only about the handling equipment.
Okay.
The question is about handling equipment.
Okay.
in manual
Yeah.
handling, that synonym word is assistant device.
Okay.
Links to.
So B is the right answer, and they just nullify the C. Opposite of C is given at the end. Even in situations where the patient preference is for it not to be used. Even if the patient says, I don't want to use it, you should use it. Okay. C option says patients have the final decision on how they should be used.
Opposite. Yeah.
But the text says patients have no voice here. Equipment should be made available and used even if the patient objects it. Correct?
Yes, sir.
Yeah.
Yes, Father.
Even otherwise, it, as you said, it's about the manual handling equipment, not about all areas. It's not about patients' decision and their opinion. It's about assistance devices. Okay. So as cool as that. Here you see one trick. This should cover beds in a minimum, but should extend to ensuite. See, overhead tracking should be installed in all new refurbished facilities. It looks as if this is same as first option, right?
Yeah, but it says about all areas.
Tracking. It's talking about overhead tracking, not the handling equipment.
Hmm.
Yeah, overhead tracking, but then the rest of the sentence
Speaks
looks
about
like should be installed in all new and refurbished facilities. Sounds like all areas of the hospital should be fitted with overhead tracking. It's speaking about overhead tracking. For option A is speaking about overhead tracking. Here it is saying overhead tracking should be installed in all new or refurbished facilities. Here first option says all areas of the hospital should be fitted with overhead tracking.
That means all done new everywhere. Right? It's wrong.
No. Now this is the technique. This is the trick they play with you. Okay. Now sometimes this will come in the option. This what is in the text. Now here you see it is all, but not all.
all new here.
No,
All
refurbished.
new.
Yeah, new and
Refurbished.
refurbished facilities. Means not all, only some.
Only
Overhead
some.
tracking should be installed in some places like which are new and or refurbished.
Refurbished.
Do you understand?
Yes, Father.
Yes.
But option A is absolute, but here in the text it is not absolute. This trick they will use always. So repeatedly they use. Sometimes they will give you this as the option. All new and refurbished areas should be fitted with, installed with overhead tracking. They will give you as an option. Then you feel that all is absolute. Is all absolute here in the text?
No, Father.
No.
No.
Yeah. But in the option, it is absolute.
It's absolute.
Yes.
And for general sense, you can understand all areas of the hotel should be fitted with overhead tracking. What do you mean all areas? Then you will not be even in your place where you park your scooty, your car, and all the areas, including the washrooms, everywhere there will be, right? So that usually doesn't happen. And patients have the final decision how they should be assisted. Normally, do they have the final decision? No.
No.
Maybe you can convince them, try to convince them, but final decision is by the health professionals. So even from the general sense, these two are, you can be eliminated if you use your general knowledge as medical professionals. You may feel, okay, right. But then B option, normally assistant devices should be used over physically handling the patient. That's the usual way you tell, no? You tell the other people. If you are a senior nurse, you will tell the juniors to use the assistant devices. So even from general sense, you can understand it. So the answer is the sorry, I have gone down. Okay, this is the answer. Okay, oh, one sec. We are in the third one, right? Yes, this is the answer. I am showing it so that there is clarity. Okay, assistant device should be used. And this is from the same material, okay? Third, fourth, fifth, continuously, you can use this strategy. Now, the purpose of the notice is to explain to occupational therapists that, what is the heading words? What are the heading words?
Purpose.
Purpose.
Purpose, okay. Purpose,
Occupational therapy.
Occupational therapist.
therapist, yeah. Okay. Yeah, to explain. Option A, confirmation of equipment is subject to availability at the time of request.
Information.
Subject to availability, right?
Yes.
Yes.
Yes. Mattresses are of standard size, so may not be suitable for all bed types. Is it absolute?
No.
No, father.
Yes, all.
No, father.
Yeah, word is absolute. What is the meaning is absolute?
No.
It
May not be
Cannot
may not be suitable for all bed types means suitable for some bed types, right?
negative.
That's the question. You should have, the meaning should be absolute. The word should absolute must be used and the meaning of the sentence must be absolute, then you will be eliminating. Is that clear?
Yes, Father.
And you will see the trick here. If you eliminate this one, you will see now what happens at the end. And now mattresses are of standard size.
Standard size.
Standard size. And next one, patient factors must be considered prior to lodging a request form.
Patient factors.
Yeah, patient factors. Okay, patient factors. First, here it is patient, here it is mattress, here is availability. Okay, availability, mattress, standard size mattress, patient factors. Okay, you can also say availability of mattresses, size, standard size of mattresses, and patient factors. Okay, now what are they? Just see the heading. What does it speak about?
Mattress.
Mattresses.
Mattress.
So if you are
Request
advanced
for
learners, you
information.
know, I told you heading is always important. Heading tells what is the content of the paragraph. And where you have mattress in the option?
B.
B.
B. Yeah, that way if you are competent, definitely after some time you will reach a stage where you'll immediately see this and take the answer option. Let's check. Don't believe me. Okay. Now, it is the responsibility of the occupational therapist attending to the individual patient to submit an equipment request form based on equipment eligibility criteria is the controlling idea. Controlling idea in the topic sentence. Main aspect of the topic sentence. Equipment eligibility criteria. Do you have any synonymous anywhere in any options?
Standard size.
Yeah, standard size. Standard size is the equipment eligibility, right?
Yes, Father.
So again, you have a clue in the topic sentence itself. If you have seen all the paragraphs I have said, I have shown you topic sentence gives a clue. Now this is patient eligibility criteria. Patient factors means patient eligibility criteria. You can read this as patient eligibility criteria, but the paragraph speaks about equipment eligibility criteria. So can this be right?
No, Father.
No, Father.
Never, never, because that is speaking about patient eligibility criteria. We are bothered about mattresses, not patients. Okay? Yes. Now, a pressure mattress may be appropriate when someone is at risk of a pressure injury as evidenced by documented and sound clinical reasoning, and their pressure injury risk is unlikely to significantly change. Environmental and equipment considerations must be confirmed, such as the patient's weight is within the safe workload of the equipment requested. The size of the mattress must also be compatible with other bed equipment and accessories, and the patient has been informed regarding the contraindications of placing items, example, all those things, on top of the mattress. Only after this confirmation should an ERF be submitted. So what they say, all these things, mattresses is a standard size. What mattress is available is of a standard size. So when you order, you must see that that size fits the patient and the other environmental factors or the facilities or the space inside your hospital. Do you understand?
Yes, Father.
Understood.
Okay. Okay. The size of the mattress must also be compatible with other bed equipment and accessories. Again, it says it's of a standard size, right? When you order,
Yes, Father.
see that
Yes,
it's useful for your situation. Mattresses are of a standard size.
Standards.
Is that clear?
Yes,
Yes,
Father.
Father.
Yeah. So here, this is I wanted to highlight this all bed types. May not be suitable for all bed types. If you think this all is,
Not absolute.
yeah, if you think this is absolute and if you eliminate, what will happen?
We will
You'll
select
be,
the one.
you will be eliminated, right? You'll be eliminated from the flight. Okay. So I just want to caution you. There should be absolute word and meaning should be absolute. So the answer is B. Sorry, not that. Okay, here. B. Yes. Mattresses are of standard size, so may not be suitable for all bed types. Next one, again, same. So from the same material, okay? Third, fourth, fifth. Just to show you, sometimes it can be so easy. Now, the memo about the use of smartphones during surgery tells staff that. So, fast, hedging words.
Smartphones.
Smartphones.
About
Use
And
of
stuff.
smartphones, okay?
Memo.
Okay, staff,
yes, sir.
okay. Their use may be a violation of patient confidentiality.
Patient confidence.
Patient confidence.
They are to be used only by the surgeon.
Surgeon.
Used only by surgeon. They
Mm-hmm.
can potentially lead to patient harm.
Patient harm.
Okay. Surgeons can use smartphones without any restriction. Is that okay? In the operation theater.
Not okay. Not okay,
Not
Father.
okay. From general sense, it is not okay, right? Their use may be a violation of patient confidentiality. Okay, let's see. Memo, restricted use of smartphones during surgery. Restricted use of smartphones is a heading. Restriction on use of smartphones. A smartphone technology has become increasingly common. It is now a cause for concern when used within the operating rooms, especially as a major source of distraction. The topic sentence says it is now a cause of concern, a major source of distraction. Okay. If there is a major distraction when you do your surgery, when the doctor does the surgery, what will be the result?
Patient harm.
Yeah, patient harm. Indirectly, topic sentence tells you. That's why I said you be patient and work out. As soon as you read the topic sentence, you will get the answer. Okay? Simply read that a cause of concern, because a major source of distraction, which says maybe since no, doctors and nurses are using cell phones during surgery, many patients die. Okay? So you have a clue there in the topic sentence. For this reason, the use of smartphones within the operating rooms will now be restricted. Okay? The undisciplined use of smartphones, whether for telephone, email, or data communication, and whether by the surgeon, whether by the surgeon or other members of the surgical team. Which option?
Be eliminated.
Yeah, be eliminated. Be eliminated, because they're not only surgeon, anyone. Okay. Only during the practice you need all these things. Okay, otherwise not required at all. May compromise patient care. May compromise patient care. What does it mean?
Patient harm.
No, patient harm. May compromise patient care means patient harm will happen. Can potentially is equivalent to
Danger.
synonymous of may.
May.
Okay. May, potentially, perhaps, maybe. Can lead to patient harm. Compromise. Okay, is the synonymous of lead to.
Lead to.
Okay. So the answer is directly there. Even the topic sentence, it was there. That's why I said once you are competent with the topic sentence, the controlling idea in the topic sentence, you get the answer very easily. Whenever possible, members of the operating suite team should only engage in urgent outside communication during surgery. Personal and routine calls should be matched and kept as brief as possible. Incoming calls should be forwarded to voicemail and all those. Any use of a device or its accessories must not compromise the integrity of the sterile field. Okay? It can compromise the integrity of the sterile field. What does it mean?
Patient harm.
Patient harm. And special care should be taken to avoid sensitive communication within the hearing of awake or sedated patients. Yeah, even avoid sensitive, and that's also indicates patient harm. Okay. So ultimately, does it speak anything? Yeah, does it speak anything about patient confidentiality?
No.
It's not given at all. The whole concept is not given at all in the text. Is that clear?
Yes, well.
Yes, one.
Yes. Beautifully done. Okay, this is the answer. They can potentially lead to patient harm. Again, sixth one in the same material, okay? Do you have stamina to go on?
Yes, Father.
5 more minutes. 5 more minutes. Yes. The main point of the extract on subcutaneous cannulas is to explain. Tell me the heading words.
Subcutaneous cannula.
Okay. Cannulas. Okay. Then
Main point.
main point.
Main point.
Yeah, main point is very important because there will be many sub points, but we are there asking which is the main point. Okay. The versatility of their design and function.
Design.
Design and function.
Okay, design and function. Then that they must only be used by registered nurses.
Registered nurse.
Registered nurses.
Is there an absolute here?
Absolute. Only.
Must only.
An absolute.
Only is the absolute.
Somebody says only is absolute. I did not say. Since somebody said, I eliminated. Okay, let's see. Okay. Yes, that is absolute. Right, you are right. So see the need for a backup cannula in case of malfunction. Backup cannula, no?
Backup cannula.
Backup cannula is important. Even malfunction is important, but main thing is backup cannula. Okay, so you have only two things: design and function. Backup cannula. Okay, subcutaneous cannulas. That is the heading. A subcutaneous cannula is a small plastic tube designed to carry medication into the designed to carry medication into the body. What is the design? What is the function? So beautiful. Topic sentence. What does it mean?
The versatility of their
Carrying medication into a person's body is the function of subcutaneous cannula, right?
Yes.
So the topic sentence answer is that. That's why he said once you are competent. I have not selected this. It's continuously 3, 4, 5, 6 questions are there. If you get such a material within 10 minutes, you can complete the whole B and C, or maybe 20 minutes. Don't you see? It is synonymous of design and function. Designed to carry medication into a person's body. Okay. Now they are next. What they will explain about the design. Supporting sentence will explain about the design, which is not important. One hand inserted by a registered nurse sits just under the person's skin. Where does it sit? Okay, the other end divides into two parts. Other end divides into two parts. It's again and shaped like a Y. What is it? Design. Yeah. One part of the Y arm can be connected to a syringe. Again, design. Y arm connected to a syringe driver or infusion pump. Design. The other can be used for subcutaneous injections. The nurse may insert a second cannula. Now this starts a second cannula. Okay? Second cannula. That is?
Backup cannula.
Yeah, in case backup cannula. The need for a. The need means necessity, right?
Yes.
Means must it is. But here they are saying later on, maybe advanced learners will understand, may insert. Text says may. You can, if need be, you can insert. But the option says the need for a backup cannula in case of malfunction. Okay? Even otherwise, what is the main point?
The
main point is in the topic sentence. It can never be after that. Main point must be in the topic sentence. So when you highlight main point here in the what is that? Question stem, they are saying you read only the topic sentence. That's the main point. Then only the explanation of topic sentence in the supporting sentence and developing sentences. Did you understand?
Yes, Father.
Yeah. Sorry. Yes. See, as we have seen earlier, I am reminding you, structure analysis approach I taught you, most important information in the beginning, then supporting details, then general information. They are asking the main point. So it should be the most important information, right? Yeah. So most important portion will be, information will be in the topic sentence. Then some other important information will be in the supporting sentence, less important developing sentence, then conclusion. So that's why I taught you structural analysis approach. Okay. And also I taught you peel approach. Where will be the point?
Main
Yeah, in the beginning point, then explanation, then evidence or example, then link. Okay. When they are asking main point, where is the point? Point is in the beginning. So beautiful. So the main point. Okay. So the answer is the versatility, right? There is a spelling mistake, I believe. Versatility of their design and function is A option is the right answer. One more you can go on. Or exhausted? Last one. Okay. The writer suggests that restless leg syndrome, RLS. What is the hedging word?
Restless legs.
Suggest means modal verb. Which modal verb? Suggestion. Good, all those. Yeah. So, is impossible to cure. What is impossible? What is impossible? Impossible. Huh?
Not possible.
It won't
Not
cure.
possible.
Absolute. Impossible to cure. In medical field, you can't say that. Impossible is absolute, right? Extreme and
Yes.
Okay.
yeah. So that is, I'm giving you some example. Don't stick on only to those words. If the meaning gives, sorry, there is some problem. Sorry, let me check. Yeah. Okay. So this is eliminated. Sorry, there is some distraction again. Siba,
Yes, sir.
the instrument is disturbing, I believe. Is it?
Sorry
Yeah.
for that.
Please keep muted when you are not speaking. Okay. See that at least during 1 hour session, nobody is in your room, if possible. Okay. Otherwise, keep muted. I said you have an option. You can keep muted the audio, not the video. So, second one could lead to depression. First one, the subject was cure, right? Second one, subject is depression. Doesn't occur during the day. Doesn't occur.
During does not occur.
What is does not occur at all? What is it?
Extreme level.
Extreme.
Yeah, extreme.
level.
Extreme.
Never.
Yeah, that is extreme. That's absolute. Don't believe me? Let's check. Does not occur. You cannot say in medical nothing will happen during the day. Okay, absolute. Extreme poles are not possible. May relate to pain management. May is might. Here,
Or chances.
so here concept is subject is pain management. Okay. Restless leg syndrome. The relatively common neurological movement disorder known as restless leg syndrome is poorly understood. Okay. Patients describe uncomfortable sensations in their legs and often are worse at night. Often are worse at night. What does it mean? Does it mean it doesn't happen in during the day?
It may be there, but
No.
But
So
in
it,
the night
yeah,
it is worse.
it says it is worse. That doesn't say it doesn't occur during the day, right? Yeah.
Yes, Father.
So that is eliminated. Having a huge impact on their ability to sleep and overall quality of life, experts now speculate that patients with RLS, like those with unrelieved chronic pain, might feel hopeless, leading to suicidal thoughts and actions. The risk correlates with the history of depression. Correlates with the history of depression and is independent of the severity. There is a mistake, space must be there. Okay. Severity of restless leg syndromes and demographic factors. So does it say may relate to pain management? Does it speak anything about management?
No.
No, it's not given. So if you know the absolutes, if you have eliminated those two, which is remaining now? Suggest will go with modal verb. Which modal verb? Could. You could do that. You could do that means you could have done it. Not must. You could have done it. Could lead to depression. Okay. So modal verb. Beginners, don't worry. We will teach you modal verb as in another session in detail. So the answer is
B.
Could lead to depression.
B. Yes.
Could lead to depression.
Yeah, that's the beauty of it.
Synonym is there, Father, in the text.
Pardon? What's that?
Speculate. Good option. There is a synonym In the speculate.
Speculate.
Yeah, where is it?
Expert now speculate.
Experts now speculate that patients.
Experts now speculate that patients with RLS like with this chronic pain might feel hopeless, leading to suicidal thoughts and actions. There is okay. Even that can be taken as yeah, that's right. You are
Possible.
right. Speculate, yeah. That's also a clue. Today is a speculation, prediction, model verb used. I did not stress too much. If there are beginners, they will not understand what is what because model verb just touched upon today. We have not practiced much. Is that cool?
Yes, Father.
Yes, Father.
How beautiful all these materials. No, it's an enjoyment and relaxation working on these materials. Okay. I don't select any materials. Two of these materials were sent by somebody asking for clarification on absolutes. Okay. Their meaning was not absolute. They said absolute is there and that is the right answer. Why? You said you should eliminate the absolute. But here the key says that is the right answer. It's right to ask that, right? Father said you should eliminate the absolute. But the right answer is absolute. Because the meaning is not absolute. Now you got two more absolute words today, right? Any extreme. You have to keep a diary of absolutes as well. Maybe one portion of the diary. Write down all those words, absolute words. Any extreme poles are absolute. Okay. Any extreme poles. The principle behind it, I said, in the medical profession, no absolute. Nothing is absolute. For each condition, depending on the patient, you will have to give the medication. You will have to manage them. Some may do well with diabetes, some may do well with lifestyle changes, but some may not respond at all. Some may be allergic to particular medication, but others, common others will be all right. So you can't say it's okay for all. Okay. Anusha, don't feel bad. Okay. I have just said it categorically because at least people who are watching on YouTube should understand these messages. Say, cool.
No, Father, I didn't feel bad
Okay.
because I made a mistake.
Yeah. But the mistake always, you should be careful, like, because it's going to disturb everyone.
Yes,
And
Father.
you did not keep up your promise, right? Yesterday you said you will bring at least one. Today, 6 less than yesterday. Yesterday, including me and admin, there were 26 in Zoom classroom. Now you are only 20.
Father.
Yeah.
Yeah, actually, someone talking to me in WhatsApp now. She said that yesterday, so many were on hold. They couldn't join Zoom. They were thinking because it's 100 over, that's why they are not admitting. Like that, so many were in waiting in the Zoom. Like
No,
I said,
they did not reserve. You have know the answer.
yeah,
Clearly the
I
notice gives it.
explained. Yeah,
Yeah.
but they said we have booked, like that. She's saying, and we are typing.
No, they are saying they have booked because they say in the main platform maybe please add my name. Who will add?
No,
They
yeah,
have to go from their ID to the YouTube comment space and nobody can add it. If
yeah.
Anita Taj adds, the name will come as Anita Taj there. We'll have to read all the messages in detail. Okay.
Yeah,
Now just
she's.
seeing how many 5-6 messages, immediately the admin will write down that name because it is registered repeatedly. So even
Father,
you can
one more thing,
They
post it.
said,
Father.
Yeah, please.
Anita, carry on. Afterwards, I will take.
yeah, no problem. I that's why I did not understand why they are saying. She said from morning itself I booked, and that time that father's talk,
Yeah.
class going on. That time they keep on trying the Zoom link,
Yeah.
but they are kept on hold. They are saying like no one is admitting. But I said whoever is the name coming, the admins are seeing and admitting. Personally, I am
It's
not
okay.
seeing. Yeah, but
It's okay, no problem.
if
Don't
someone
worry.
is
That
upset and
that doesn't require any explanation, and they are not meant to crack OET. Because if they cannot read and understand such a simple notice, which says repeatedly click on and send to their personal chat at least twice, which clearly says first sentence says, please click on the above link and mention your availability in the YouTube comment space so that you can join Zoom. And below that, I have mentioned the Zoom link will be shared in the YouTube comment space.
Yeah.
And it is those reserved slots can join.
Yeah, everything when I asked, she said everything is says I did like that only. I did like that only.
Excuse me. To YouTube comment space live, you can join using this link. If you want to come and discuss something face to face with me, you can join now. All will be admitted. Okay. Those who are at YouTube comment space, if you want to discuss something here, I'm repeatedly posting the Zoom link. All can join now, even those who are not reserved for a discussion. Yes, you can admit all admins. And then I'll come back to Manju. Okay. Yeah. So Zoom link is posted more than 10 times. Yes, repeatedly.
Okay,
you can
Manju,
join it.
then we can talk.
Okay, Father,
Yes,
one
Manju.
more thing
Yeah.
is they are commenting, some people are commenting, I will attend, but they
No,
did
you
not
are not
mention.
audible. You are not audible. Hello.
Okay, Father, can you hear me?
Yeah, but there is a distraction. I think that issue.
Okay, maybe not issue. Okay, Father, I will check it and let.
No, it's not. You are a network issue that side, not here. Excellent connection. It says, I will join next class. It's okay. It's okay, doctor.
Father, Anita, can I leave for today, Father? Yes, I have
Please,
some.
yeah. And Manju, yeah. Anyone else? Manju, anyone else? Yeah, the network issue.
Father, your voice is breaking.
I'm having network issue. It's excellent connection.
Yes.
Breaking, brother.
Huh?
Voice is breaking.
Hello?
Voice is breaking, brother. Those are joined now. Please switch on your videos.
The conversation I'm audible. I'm audible.
Father, from your side, voice is not clear. It's breaking.
Some network issue, I believe. Okay. But it's excellent connection with you.
Can I leave, Father?
Yes. Hello. Those in the YouTube comment space, if you want to join,
Father, still some
Zoom, they
distraction
can.
there, Father.
Manju, it is my issue. I feel. Let me try to disconnecting phone and other instruments, but it's showing as excellent connection.
No, it's not clear, Father. Your voice is not clear. Mini, check it. Can you hear?
It's breaking. Father's sound is breaking.
Yes, Father sound is breaking.
Father is
Can you
having.
rejoin now back.
Some network issue. Okay. Am I audible? No, you can discuss each other. Maybe if I am not
Now
audible, you can discuss each other.
Now
Others
it's
can
clear,
ask
Father.
admins will also.
Now we are clear.
I think there is a network issue with me, with my
Now it's clear, Father. Your
system.
voice is now audible. It's clear.
Hello.
It's clear, Father.
Hello, Father.
Hello.
Hello, Father.
We can hear you,
Am I
Father.
audible?
Yes, Father.
Yes, Father.
Yes, Father.
Audible?
Yes, Father.
Yes, Father. We
Yes,
can
Father.
hear.
I think there is some network issue. Cool. Anyhow, clear now.
Hello, Father.
Vlog says clear now. Is it clear?
Yes,
Father.
Father.
Now clear.
It's cool. Anyhow, session was not disturbed. There is some issue. Some people say clear. Some people say it's breaking. No response from here, so we'll stop for the time being. Right?